standing up and we're fighting back for the safety of our patients. We need ratios. Ratios save lives.
It's dreadful at the moment. We have people that have to do overtime all the time because we don't have enough staff. We have a ratio of 1 to 8 on night duty. I'm often in charge and I have 8 patients as well. The quality of care isn't the same as it used to be years ago. It's atrocious because we just cannot answer the buzzers in time.
We often don't have the staff to cover the hips patients, and we're often having to take that out of numbers, which means that we're left short on the floor, putting other patients at risk.
Would you like to sit on an ambulance stretcher for more than 5 hours? I know I wouldn't. This is happening daily. We discharge patients too early. What happens when we discharge patients early? They bounce back. Is that good care? No. Does that cost us more money? Yes. It does. We need patient ratios to care for these patients. This is what's going to create safe environment.
Nursing, it's deteriorated. We're not there for the patients anymore. We're there to tick boxes. I had a patient that was deteriorating before my eyes last week, and I couldn't get to her because of these patients.
We need to feel valued and be given the resources to look after them safely.
Don't give up. Keep fighting because it will change, because it has to change.
The New South Wales Government has rejected our shift-by-shift nursing ratios. New South Wales don't have shift-by-shift ratios, whereas Queensland, ACT and Victoria do. We are asking for 1 to 4 in acute areas and 1 to 3 in ED.
Nurses confronted the minister, calling for better ratios.
You have the power to change this, Brad. Why won't you?
Because of the fact that those recommendations are not what health thinks should operate.
I think he fobbed us off, he made anti-union comments, he was quite hostile, and the nurses and midwives deserve better than that, and so does the community.
What do you want? Ratio! When do you want it? Now!
We know that the government is just not listening. When you look at the support that's been given in healthcare, nurses and midwives are the ones that have been left behind.
We come onto a shift where there's no ratios, where we're short-staffed, overworked, underpaid, and we're expected to cop it.
It's 12 years that I've been fighting for patient ratio. I feel like I'm Bill Murray in Groundhog Day. This needs to happen. It needs to happen now.
It's a very basic request to have safe ratios. You're not even asking for anything for yourselves. You're asking to make sure that the patients that you look after are properly cared for and are safe.
We're 100% supportive of the nurses and midwives that are fighting so hard to protect patient safety and to make sure you have the working conditions that you deserve. Ratios are absolutely critical.